You were talking this morning about big strides in the push to pass the first drug to treat women with low sexual desire. Dr. Irwin Goldstein from San Diego Sexual Medicine joins us now with the latest, along with Barbara, who participated in the clinical trials for this drug. Okay, so first of all, Dr. Goldstein, let's start first with you. Talk, if you would, about this recent FDA news concerning this drug.
So there was a press release, Erica. First of all, thank you for doing this. There was a press release that this drug, flibanserin, has been received by the FDA, and in September they need to make a decision, yes or no, that this drug gets approved. Multiple drug studies have shown it to be safe and efficacious, and we fully expect it to be the pink pill, the first for women. And we talked about this, 2013 is the year of the woman, we hope. Barbara here was part of the earlier clinical trials on this product, and I'm so happy that she agreed to be here. She was in what's called an open label trial, where she knew she was getting the active drug and there was no placebo arm to this. And she's going to tell us about her experiences.
Yeah, and Barbara, I want to go to you now. Tell me, if you would, gently, as it's a family morning show, but tell me, if you would, a little bit about your experience while you were taking the drug.
Well, at first, during the clinical trial, there was nothing, because I was on placebo, but I didn't know it. It was a blind study. However, after that segment ended, I started taking the real thing. And within 1 week, my whole life came back into order.
Really?
Yes. I mean, I have a wonderful marriage. I have a wonderful husband. I have a wonderful family. And it wasn't complete. That's the reason I started on this clinical trial. And within 1 week, it was like, wow, this really works. It really, truly works. And after a week, they pulled the drug. And I was really upset about that, because there's so many women out there. I know a lot of physicians and gynecologists, and they want to give their patients something, and there's nothing to give them. And it's so frustrating for women. It is so frustrating. So that was another reason I'm working with Dr. Goldstein on this, because he's an amazing man, and he cares so much about women and their sexuality, men too, but there's not much out there for women.
When was this that you were doing the trial?
Oh, it was a few years ago now.
2011.
And what did your, not to get too personal, but what did your husband say while you were on this?
Oh, he was amazed. It was actually funny, because you wake up in the middle of the night and you're like, wow, I really have feeling and desire, and it's back, and this is great. I'm 30 years younger.
Yeah. Dr. Goldstein, are her results, is this what most people were seeing?
This is a fabulous drug, and 11,000 people have been studied on this drug. It's been 10 years in development. Where she had the drug stopped, it was when the drug company had it. The FDA made an initial ruling not to approve it. Another company bought it, did 3,000 more patients to show more safety, and now it's back at the FDA, and in 2 months they have to make their decision.
What do you predict will happen in 2 months? Do you think they will approve it?
So I'm so optimistic that this will happen. The data are really supporting of it. So there's a lot of women with low interest, and we're doing other clinical trials beyond this drug, because now, with the impending success of this, other companies are saying, wow, we can offer additional therapies for women.
And you're still taking patients for that?
We're starting one next week, a new clinical trial. So anyways.
Excellent. So if this is approved in September, this particular drug that we're talking about with Barbara here.
She'll go back on it.
You go back on it.
Oh,
but how soon till Barbara could get it and everybody could get it on?
Well, theoretically, once it's approved, it should be
like that
in the drugstores within a reasonable period of time. I mean, I have to go to the drugstores, but.
What's it like for you waiting?
A little nerve-wracking. I would like to get it yesterday.
Yeah.
And even my daughter, I mean, she's only 30-some years old, but it affects your relationships, and that's the whole thing. It affects your wonderful relationships. You're supposed to be partners and working together, and when one isn't functioning properly, it's nerve-wracking that you can't get this.
I would imagine it'd be so tough to have had it and then now not have it anymore. That's got to be really frustrating.
Oh, yes. Dr. Goldstein knows how frustrating that was.
But we really, I mean, it's a new era. I remember in 1998 when Viagra came out. This is 15 years later. It's now time for the women's era, and we fully expect this to be.
What were the side effects that people were experiencing?
So they have a little somnolence or sleepiness.
Okay.
So they decided to make the indication you take the pill at night. So
Gotcha.
it actually will help you sleep. So if you're a woman with sexual problems and tiredness or can't sleep, this double treats you.
Right. Barbara, did you experience some sleepiness or any other side effects?
No, I experienced no side effects.
You were wide awake.
I was wide awake. Ready to go.
Well, this is fascinating stuff, and people, if they still want to participate in the clinical trials that you guys are doing, they can contact you?
Right, so it's 619-265-8865.
Okay, say that one more time.
619-265-8865.
And we have the number up on your screen right there. You're still taking people, and the
desperately,
trials are
yes.
going to begin next week.
Yes.
So if people want to try it out.
So thank you so much.
Thank you. We appreciate it. Barbara, thank you for telling us your
Erica.
story. We really, really appreciate it. And if you want more information from Dr. Goldstein at San Diego Sexual Medicine Alvarado Hospital, all you have to do is go to our website, fox5sandiego.com, and click on that Scene On tab. Okay, Raul, we'll send it on back over to you.